Welcome back to Therapeutic Window. I'm Pat Sharp, medicinal chemist, and today we're going to be talking about some really exciting breakthroughs in the development of non-opioid pain medications. I think this is a super important topic. It's one that has had a massive effect on society over the last 10 years, and there's been some new understanding of the science around this and some new developments that may mean there's a solution to the opioid crisis on the horizon. So opioids are actually a really old class of drugs. They've been around for hundreds of years, but really in the last 10 years, they've had this massive negative impact on society. They've, 10 million or so Americans abuse opioids, and this has led ultimately to over 70,000 deaths due to overdoses from opioid-related drugs, including prescription opioids, but also things like heroin and the synthetic, really potent versions like fentanyl. So new ways of managing pain, new medications that can block pain signals, especially for serious pain, would be an absolute game changer for society. It would give doctors an alternative to prescribe without the potential for abuse and the potential for overdose, and would probably have an impact on the overall life expectancy across America these days. So one of the companies that's been making real strides here is Vertex Pharmaceuticals. So Vertex Pharmaceuticals, they're a company based out of Boston and San Diego, and they've been developing a new type of non-opioid pain medication called VX548, also called suzetrigine. And this has a completely different mechanism of action to opioids and is opening up a new class of drugs. So specifically, this VX548 is an inhibitor of a NaV1.8 protein, and I'll talk a little bit more about what that is in a moment. So the way these drugs work is really unique. So in this mechanism, they actually block the touch and pain signals that come through the dorsal ganglion cells, which are the cells that transmit signals from your body into your spine and then into your brain. And so the concept for this new mechanism for blocking pain comes from a genetic condition known as congenital insensitivity to pain, or CIP, with anhidrosis, where people who have this condition can't feel pain due to mutation in this SCN9A gene. And this gene encodes for the NaV1.8 protein. The NaV1.8 protein stands for a voltage-gated sodium channel, and this NaV1.8 channel plays a critical role in transmitting pain signals from the periphery to the nervous system. And when these channels are non-functional or absent due to genetic mutations, people with these mutations don't perceive pain, which can sometimes lead to really severe injuries and complications in these patients. Typically, they're unaware of damage that might be happening to their body. So, for example, if they're standing in front of a fireplace, they could get significant burns without actually realizing it's happening because they can't feel those signals of pain or heat coming through. And this is in contrast to opioid pain medications, which work completely differently. So they block specific receptors known as mu-opioid receptors, and these are found on nerve cells, in the brain, spinal cord, and all sorts of other parts of the body. And opioids block the transmission of pain messages to the brain. They reduce the sensation of pain, but they also have multiple other functions, like, for example, controlling respiration. And respiratory depression from opioids, and particularly overdoses, by inhibiting the mu-opioid receptor, is what leads to death from overdoses in those cases. But also opioids can produce this sense of euphoria by affecting brain regions that mediate pleasure. And this psychological effect contributes to their potential for dependence and abuse. So this dual action of pain and emotion is what makes opioids actually such potent and effective painkillers, but it comes with these significant risks, especially if they're not used appropriately. But this alternative mechanism using NaV1.8 inhibitors don't have any euphoric effects, they don't have any effect on the respiratory system, and so have a much better chance of having a therapeutic window, not being abused, and not leading to overdoses. And there's been some really exciting clinical trials on this new drug, VX548, that have recently been published. And so two new results come from some surgical pain trials. So one, patients had bunionectomy, so getting bunions removed from their feet, for example. And the other one is in patients who had abdominoplasties or tummy tucks, both of which are apparently pretty painful surgeries. And so the TLDR, both of these trials, it looks as though they were quite successful. So the primary endpoints in both of these was beating placebo at 48 hours post-surgery, so a lower a lower perceived score of pain in the patients reporting on pain after these surgeries. And this is actually quite a big deal. The placebo effect in pain trials can be quite large. So people who are taking a pill, who are thinking they're taking medicine, often have this sense of having pain relief, even though they're not actually getting a drug that's having any physiological effect on them. So to even be placebo is pretty tough in these trials, and these were significantly better. But importantly, they also tested VX548 against the standard of care, which is Vicodin, an opioid-based pain medication. It's a combination of hydrocodone and acetaminophen. And VX548's effects were equally as good as Vicodin in the tummy tuck patient, so just as effective as reducing pain after that abdominoplasty surgery. And even in the bunionectomy surgery, they were comparable, not quite as effective as Vicodin, but very close. And especially as time went on, they got better and better, more and more close to Vicodin's effects. So these are significantly important results, and really should suggest that physicians now have an option of prescribing an alternative medicine to an opioid, which has much less potential for abuse and much less potential for overdose. So one of Vicodin's advantages or disadvantages, depending on the way you look at it, is that it's actually really cheap. It's a generic drug. So this will make the decision by physicians to prescribe this brand new drug, which is almost as effective, just as effective in some cases as an opioid, which doesn't have these side effects, versus a much cheaper drug that does have all these side effects, because now that drug has become generic. And which might be trickier than it sounds in actual practice. But insurance companies would be remiss if they did not provide significant rebates or discounts for prescriptions of this new drug with less potential for harm and abuse. But nevertheless, in 10 years' time, the patents will come off this drug and it will become generic as well. So in the meantime, there's going to be probably some hard decisions by physicians and insurers on making sure that all patients who require a strong pain medication get access to this new drug. But in 10 years' time, there should be no reason why you would prescribe an opioid in situations where these new NaV1.8 inhibitors were just as effective at managing pain. So I think this is a super exciting and important new step in technology in the management of pain. I think it's going to have transformational effects on society, and hopefully will also reflect well on the pharmaceutical industry as a whole. And this is just one of the many examples of new drugs that are coming out of the pharmaceutical industry that just don't get enough appreciation, don't get enough airtime, and I hope I can highlight more of them here.